Hello, this is Millie Kim, and this is a health assessment. You're getting me? Okay. And this is my patient. His name's AR. How old are you?
19.
19. Okay. We're gonna start. This is head to toe. I start at the face and head, and I first inspect, check the position, and look for symmetry. And it should be held upright, and be still. Okay, looks good. And facial features. Your facial features for eyebrows, eyes, and nose, and left and right. It looks symmetry. It's in symmetry to me. Okay. And then ears. The top part of the pinna should be in direct line with his eyes in the fissure in both sides. Turn here. Yeah. In a direct line. Okay. Okay. And it's symmetric and in configuration and height. And his skull is round. And then I'm palpating his frontal, parietal, occipital, and I feel the prominences and it's intact. Alright, and then his eyes. His upper eyelids should cover the part of iris, and it shouldn't be covering bilateral pupils. Okay. And his scalp, no lesions or scabs or scaliness. It's uniform in pigmentation. I don't see any weird discoloration. Okay. And then I'm gonna look at his eyes. Check for chrola. Do it each eye. Okay, I see his pubic constricting to right. Okay, so his pupils equal, reactive, round, in a combination. Alright, and then the lymph nodes. Oh, hair. Yeah, it's evenly distributed. I don't see any signs of baldness yet. Okay. Lymph nodes. Alright, occipital. So I'm going to feel his lymph nodes and his neck. Tell me if you feel any pain or tenderness. No. And then posterior auricular nodes behind his ears. Then preauricular, and then open your mouth, say ah, and then close it. Do you have any pain when you're opening your mouth? Okay, good. Okay. And then anterior deep and superficial cervical chain. I'm going to feel that. And then we have to make sure that we do it one side at a time. And then I'm going to auscultate, but first palpate his carotid artery and look for any bruits. Feel the pulse, but I don't feel the bruits. Now I'm going to listen to it. I just hear his pulse, no bruits. Okay. Now it's time for thyroid palpation, and he's a male, so trachea is visible. Adam's apple. So I'm going to place my thumb over trachea, and then put my other fingers. But before I do that, you need to take a sip. Here's some, I got some coffee for you. Don't drink it, just hold it in your mouth. And then when I say drink it, you swallow when I say yeah. Alright, now swallow it. See, it's obviously moving. Let's do it again. Hold it. Okay, swallow. Okay, it's good. Then it's firm, pliable, non-tender. Okay, good shape. Alright, now I'm gonna look inside of your ears with otoscope. I have otoscope here. I'm looking for the ear canal, and it looks normal. I don't see anything abnormal. Okay. Yeah. This side as well, ear canal. I don't see nothing abnormal here. Okay. And then I'm going to assess your hearing ability. We have to do 2 tests, Rin and Weber, but we don't have tuning fork here. So I'm just going to explain my patient that Rin test is to have the ability by air conduction compared to the bone conduction, and I hold a tuning fork back of the skull to assess it, whereas Weber test is assessing bone conduction, only useful when hearing loss is asymmetrical. Alright, and I'm going to be holding it at various points of the patient along the midline of the skull and face, back and forth. Alright. Okay. Now it's time for sinuses. So frontal. Here's frontal sinus. No swelling. I don't see any discoloration or inflammation. And then maxillary sinus. When I palpate, do you feel any pressure or pain? Alright. And his skin overall, it's very good. I don't see any lesions or discoloration, or it's even toned, even pigmentation. The rest of the body I'll be assessing throughout the video. Alright. And your nose. I'll be looking inside of your nostrils. Okay? Alright. Alright, there's nasal hairs. Okay. No abnormal object or lesions or signs of inflammation present. Okay, good. Down to your lips. These lips are pink, moist, smooth. Okay. And now open your mouth. Okay. I see the uvula in the midline, and then in the buccal. It's even toned, and his teeth are excellent. I don't see any cavities. You don't have any cavities. You didn't get. I don't see any signs of treatments either. Oh wow. Let me count them. Open your mouth. 1, 2, 3, 4, 5, 6, 7. 14 on the bottom. 1, 2, 3, 4, 5, 6. 12 on the top. So that's 30. So maybe he didn't have wisdom tooth yet. Alright. Okay. Yeah, and then his tongue, once again, open your mouth. I don't see any coating. It's glistening. It's pink. Yeah, it's good. And then hard palate. And then soft palate. Okay? They're intact. Okay, can you pause for a minute?